We, as the health sector, are working very closely with the Ministry of Health and the health partners to deliver the life-saving services to the affected population and to reduce and mitigate the suffering of the affected population in this country. As we know, the affected population is enormous. More than 700,000 people already displaced, and about 5 million population generally affected. 84,000 people reported dead, and around 300,000 people injured. And in the meantime, we are dealing with the outbreak of disease, particularly of cholera, as it was reported in the first few days of suspected cholera cases, and the Minister of Health confirmed about 300 cases registered, as 10% deaths or case fatality rate among them, which is actually alarming for us as the health community responding to this disaster. And in the meantime, we see that IDPs is another concern that we see throughout this disaster, that more than 700,000 population are in camps either or scattered along the sometimes on the highways, that we need to deal with the health impact for these IDPs that we deal with. Of course, there are some interventions already underway, including establishment of mobile teams, establishment of field hospitals, and delivery of essential medicines, and mobilization of health human resources to the needy population. And we are in process of strengthening our capacity to respond more effectively and efficiently. And the major areas that are seen or prioritized as health interventions at this point is delivery of essential healthcare services for the affected population, including both community level and the facility level and secondary and tertiary health care services, particularly with focus to trauma and surgery interventions that are needed for a lot of number of people injured for bone fractures as well as the crash injuries. In the meantime, we need to do early warning system. It's already in place, but we need to strengthen the early warning system and disease outbreak capacities to respond to disease outbreaks. As we already have the cholera confirmed, and some cluster cases of measles reported among the affected population. We need to provide safe water, particularly our concern is with the health facilities. Of course, we are working with the wash sector to deal with the delivery and provision of ensuring of safe drinking water for the affected population at the IDP camps, as well as the host communities which are affected. Additionally, we need to ensure availability of essential medicines, emergency medical supplies, and equipment to deal with this enormous disaster and impact on the health services. Of course, all these activities or interventions can only be possible and can be effective and efficient through better coordination. As WHO, we are working with the Ministry of Health to strengthen the coordination mechanisms and to establish a coordination mechanism at the national level and subnational level to do a better job in delivering these services to affected population.
Thank you very much. We can take questions now. CNN, please.
Thank you very much. While we and the world appreciate all the work that you have been doing on the ground, there are continuing accusations and frustrations that WHO is slow and cumbersome. Can you tell me why should the aid be funneled through WHO and not being given directly to the organizations that could perhaps act more quickly and efficiently on the ground?
Actually, it's as I mentioned, it's an enormous tragedy, and there is a lot of constraints and challenges on the way, including logistical and access, even in some areas security concerns that is hampering the process, the smooth process of delivering the response or the services assistance to the affected population. However, the coordination is working closely with the Ministry of Health and the partners, how we can channel the resources and mobilize the resources that can be utilized and can be deployed by different health partners, not only by WHO. It's not only WHO, but all health partners will get their share of resources and responsibilities to do the right job.
But why not give the money directly to those other organizations? Why go through you?
It is not, in fact, coming directly through us. It's coming through cluster or the sector coordination body, which is bringing and mobilizing resources on behalf of the whole health partners. It doesn't come to WHO, but to the sector mechanism.
I have a question by Twitter related to this. At MSF writes, we will coordinate with, but will not be coordinated by the World Health Organization. Do you have a comment to that?
Actually, indeed, they may perceive it as such. However, the coordination is with the partners. It's not by WHO. It is with health partners as in practice.
Thank you very much. Yes, please.
In the last few days, I've met many people who have been afraid to go back to their houses or sleeping on the roads. They're obviously traumatized. And the mental health systems in this country were weak before the disaster. Is this something you've identified as a priority for the future?
Yes, it is a health concern as part of the basic essential services to be provided for the affected population. As mental health in the aftermath of disasters as such, it's always mental health is a priority for the health response. However, the infrastructure before the disaster was strong in this country, and they had an optimal level of services for mental health. But at this point, we need to coordinate and to prioritize the interventions for mental health problems, and with particular focus to children under 5 or children as a whole to be considered and be coordinated with the protection sector, which is also dealing with children, mental health problems.
BBC would like to know how many people has WHO got on the ground at the moment. We would like a figure, please. And to follow on, what advocacy measures do you use to carry out your mandate in a crisis situation such as this?
Actually, for leading this emergency response process, we have 8 people on the ground that just arrived on the 3rd day of the disaster. However, we are in discussion with many potential supporters and contributors like USAID and other partners and CDC to bring more people on the ground to support us in this process. And we are using every channel to advocate on behalf of the people of clandestine to bring the message to the world community to bring more support and more help to this disaster people.
Hashtag Health Security asks about cholera. Asks the government released figures a few days ago saying there were 300 suspected cases, 10 confirmed. What are the figures today? And what are you doing about the movement of people, including international humanitarian workers, in and out of the country, and the risk of spreading cholera beyond?
The figures that were mentioned still, stays or remain the same as 300 suspected cases registered and 10 deaths, 30 deaths, which means like 10% case fatality rate. However, on advising or regulating the movement, this is a government policy, and the WHO is very much advising the people who are moving to clandestine to be cautious and take more care to use clean water and use proper sanitation to avoid cholera as a disease. However, there will be no restrictions be put. It is just an advice as health system to be in place for the people who are entering the country.
I know all of our health leaders need to get on to actually providing health services to people, so we're going to thank them all and thank you all for your attention and your interest.